Hello, dear friends. My name is Sofya Dorinskaya. I am a psychiatrist. And today I want to answer questions regarding the treatment of mental disorders and fasting. There are already quite a lot of questions on this topic about my attitude towards it. In general, I answered how I feel about this in my book, This is Crazy Psychiatry. This book can be purchased in bookstores. This book was published by AST as well as EU, can be ordered from various online stores. But today I want to share with you some detailed information regarding those specific clinical observations, about that particular clinic, and about those various manifestations of severe alimentary dystrophy or alimentary exhaustion. This term essentially means related to nutrition and the digestive process. Nutrition dystrophy is already starvation, the fading away of a person from hunger, which was described by doctors in besieged Leningrad. Today I will tell you, based on the manual or the publication, Questions of Pediatrics During the Siege of Leningrad, first collection, Alimentary Dystrophies and Vitamin Deficiencies in Children. This is from 1944. So alimentary dystrophies, or these states of fading away from hunger, are divided into 3 degrees. A mild form of dystrophy refers to people whose overall condition is quite satisfactory. The child leads a normal lifestyle, but the turgor of the soft tissues decreases, that is, the tension, so the tissues become somewhat flabby. The subcutaneous fat layer decreases somewhat, and muscle strength weakens. Weight drops noticeably. Appetite is normal, and more often even increased. There is a tendency toward constipation. No other abnormalities in the internal organs are observed. So we see a child who has lost weight for some reason. And it seems like he is completely normal, but he is very eager to eat. This is what we call the mild form of dystrophy. Next, the second degree of severity. And here I want to draw attention to the psychological symptoms. Neuropsychological symptoms are almost always pronounced. Children are irritable, sleep poorly, cry a lot, constantly feel hungry, and eat everything greedily. And the severe form, the third degree of alimentary dystrophy. Psychological manifestations. So, general adenemia, meaning the person stops moving and lies down all the time. An indifferent attitude toward others. Drowsiness, hypothermia, lowered body temperature, and chills. Speech is monotonous, somewhat staccato. That is, to speak staccato means to say something to an audience in abrupt phrases. If we take a close look at the psychological phenomena and how a person's life dynamics gradually decline, depending on exactly how much they eat, the less they consume on a daily basis, the more we see that, on average, people become irritable, sleep poorly, feel a persistent hunger. Children cry more often, and as for the adults, I suppose they also struggle. Demonstrate violent insanity. That can happen too. But as we go further down into the severe form of alimentary dystrophy, people become indifferent. They lie in bed. They show indifference toward those around them, drowsiness, and a tendency to feel cold. People start to feel chilly. In other words, to put it simply, they lose the energy for any activity. There is an active display of pain and hopelessness. In other words, to put it bluntly, the body has given up and is lying down to die. Can we really say that we are treating people with mental disorders by depriving them of food and bringing them to such a half-dead state? To be honest, I think that statements like that, well, they're simply irrational. In one of my previous videos, I said that we need to decide whether we are dealing with life or with death. When we deprive a person of food because of their mental disorder, we deprive their body of energy, we deprive their body of life. Yes, a wild life, the life of someone insane, a life we don't understand, a life that threatens us. But it's still life when we put this person in a hospital bed, because they are suffering from extreme starvation. and simply do not have the physical strength or energy to manifest the vibrant life that is within them. And yet we mistakenly refer to this as a cure. This is unprofessional and it is a crime. Please ask anyone who has been in a psychiatric hospital. In a closed hospital, a person cannot leave. They cannot make decisions about their own life. There, they are treated like an animal controlled by everyone. And so the person is there and they're told, fine, choose injections of haloperidol, electroshock, insulin shock, or you will go hungry. And the person, well, just ask them what they would choose. Of course, they will choose the third option. And by depriving a person of food, you simply deprive them of the strength to live their life. Is this recovery? I think no sane person would say that this is recovery. Let me repeat myself once again. The criteria for health from a statistical point of view is the ratio of days of ability to work in a year to days of incapacity. Any doctor, if they claim to be restoring health, then objectively what we can look at is whether this doctor is returning a person's ability to work. If a person was partially able to work, of course not as a result of losing any organs or parts of their body, then if their work capacity category improves, for example, they were in the second disability group and you move them to the third disability group, then we say that we have restored their ability to work, which means we have moved the person closer to health. Is it really treatment to bring a person to a state of apathy, indifference to those around them, drowsiness, and generally a half-dead condition, and call that curing their mental disorder? Because, excuse me, even to experience hallucinations, you need strength. You need energy to see hallucinations or to hear those voices. But when a person doesn't hear them simply because their body doesn't have the strength to carry out certain biochemical processes, we say that we've cured this person, but that's just a complete and utter fabrication. It's calculated manipulation. It's the mere superficial appearance of actual psychiatric work. And of course, I focus entirely on life. That's what I've chosen for myself. I simply do not deal with the concept of death at all. And no matter how hard it is to pull a person out of the abyss, and no matter how difficult it is to guide them along the way, when their nervous system comes back to life, when they start to get indignant, when a child starts... At first he didn't notice anyone around him at all, but now he sees his mom and dad and starts bossing them around, starts manipulating them. This is actually an improvement because life has started to control something around itself. Yes, it's unpleasant. And no one is saying that the road from psychosis to sanity is a pleasant one. Well, that's exactly what makes the psychiatrist's job so difficult. That's also what makes the work of psychiatric staff so hard, because it's tough to deal with such people. But nevertheless, this is the road to life. It's the road of life, and if we know how to walk it, if we know how to accompany a person along this path, if we know how to educate their relatives, explaining what is happening to our patient, why this is happening to them, and why they need to be patient with them, with such manifestations, and to keep feeding them, to keep reviving their body for life, that's when we are truly walking the road to life. But the simplest way is to deprive a person of food to such an extent that they simply don't have the strength to express the life that remains within them. And it is outright fraud to claim that we have cured them. That's what I wanted to say on this matter. Once again, I want to say that I have covered this issue in detail in my book, This Crazy Psychiatry. You can buy it. It is sold in bookstores and it is available in online bookstores as well. I know for sure that it is sold in all CIS countries. It's definitely available in Ukraine, it's available in Belarus, and of course in Russia. Please, here you will find the answer to this question. I hope I have answered in this video to the question regarding fasting and treating mental disorders in this way. And I want to let you know that we have a second video channel. It is called Sofya Dorinskaya, Dorinskaya with an O. You can find this channel among the recommended channels. And under this video there will be a link to that video channel. And now videos will be made alternately, one for the channel Evidence-Based Medicine and one for the channel Sofya Dorinskaya. Therefore, if you don't want to miss any videos, please make sure you are subscribed to both channels. This was Sofya Dorinskaya with you. All the best. Goodbye.